Welcome to Fempower Health. This is Georgie. Thank you so much for tuning in today and for listening. I know your time and attention are precious, so here's exactly what you'll get from today's episode. I'm pulling together stories and data that might look unrelated at first. Your gut microbiome, chronic pain, ADHD reframed as an adaptation, and what's happening with menopause policy and funding right now. These threads all point to the same big question. Why do we keep treating our bodies in silos when they're deeply connected? Why does this matter for you and for the system? This isn't just about individual health or only about women's health, although women's experiences often show these cracks first. When we fail to connect the dots, gut, brain, hormones, pain, mental health, people get dismissed, misdiagnosed, or forced to become their own project manager just to get care. If you're a patient, this helps you know you're not imagining it. If you're an advocate, a startup founder, or someone shaping how healthcare works, this is the context you need to push for real change. So let's break it down, starting with the gut microbiome and chronic pain. A new study backs up what so many of my expert interviews have hinted at. Your gut microbiome can hold signatures for chronic pain conditions, from fibromyalgia and complex regional pain syndrome, or CRPS, to arthritis and migraines. Researchers even found that transplanting gut bacteria from fibromyalgia patients into mice caused pain-like behaviors. When the mice got healthy donor microbes instead, the pain-like behaviors reversed. Fascinating, right? But here's the reality check. We're not yet ready for routine microbiome tests or gut fixes for pain. The science is still early and results are hit or miss. So short-chain fatty acids, or SCFAs, seem to play a role, but we need more data. An anti-inflammatory diet and probiotics might help, but personalized test and treat just isn't here yet. So my take? This is yet another clue that the gut-brain connection is huge, not just for digestion, but for pain, immunity, and inflammation. And it's why I keep saying the vaginal microbiome deserves just as much attention. If you missed my conversation with Dr. Caroline Mitchell on vaginal microbiome, listen to it. She explains how your vaginal flora shapes your overall health in ways we're only starting to understand. You can see a link to that episode in the show notes. Next, let's talk about ADHD, because new research is adding evidence to something many people with lived experience have been saying for decades. ADHD isn't just a defect to fix, it's a trait that in the right environment could be an advantage. In one recent study, researchers tested what's often called the hunter in a farmer's world idea. Participants with ADHD traits did better at a foraging game, basically a scenario where they had to gather resources, know when a patch was running out, and decide when to move on. The people with ADHD traits pivoted sooner and ended up collecting more overall. What's labeled as impulsivity or distractibility in modern classrooms or offices might have made the difference between feast or famine for our ancestors. But here's the bigger question for us today. Our systems haven't evolved alongside this understanding. Most schools and workplaces still treat ADHD traits as problems to suppress, not patterns to work with. And for many women, there's another layer, hormones. In one study, it showed that over 40% of women with ADHD also have PMDD, a severe hormone-driven mood disorder. Hormonal shifts can amplify ADHD traits in ways we rarely acknowledge in education, mental health, or policy. I'm now genuinely curious. If this research holds, what does it mean for how we design school, work, and support systems? How do we make space for traits that don't fit the standard mold, but are deeply human? And for those navigating ADHD in a farmer's world, what would meaningful change look like beyond just medication or coping strategies? After years of interviewing experts, I believe we underestimate just how much neurodiversity and hormones shape the entire arc of mental health, and we still box them up in silos. If you're curious about the hormone side of this, check out my piece on mental health and menopause, because again, it's all connected. Finally, let's look at menopause, a case study in what happens when we ignore what affects half the population. More than a dozen states are finally stepping up. From California to Oregon, Illinois to Rhode Island, new bills are pushing for insurance coverage, clinician training, and even workplace protections. Let's look at the numbers. In 2025 alone, we've seen 15 plus states introduce 24 different bills focused on coverage, CME for doctors, public education, and flexible workplace protections for people managing menopause. Let's look at the backstory. Menopause care got sidelined for decades, partly because the Women's Health Initiative study published in 2002 linked hormone therapy to breast cancer. Those results were misunderstood and blown out of proportion, and the result, 23 years of lost training, research, and real care for millions of women. And there's good news. There's real funding now to rebuild the pipeline. The Menopause Society's NextGen Now initiative, which launched with a $5 million grant and aims for $10 million, plans to train 25,000 providers over the next 3 years using immersive tools, new guidelines, and maybe even AR, VR. But here's the bottleneck. Big money and big bills are encouraging, but they don't automatically fix access. We have a growing shortage of providers who even have time for longer menopause visits. And many gynecologists are shifting to cash pay because insurance doesn't cover what real care costs. Women are waiting months for appointments if they can't find one at all. I've written about the billions flowing into the menopause market and who you can actually trust. More education, better policies, and funding are all needed, but implementation is what will close this gap. Advocacy is key, and if your doctor shrugs off your symptoms, keep pushing. You deserve better. I do want to add a quick note on endometriosis. This theme shows up in endometriosis too. Massachusetts just held its first ever hearing for a bill to create an endo task force. Recognition is growing. Similar work is happening with Endo Rise in Connecticut, and it's encouraging, but like menopause, until research, policy, and care actually connect, patients will keep doing too much on their own. Now let's close this out. What do you do with all the information I just shared with you? First, remember you're not imagining it. Your gut, your brain, your hormones, they're always in conversation. Better care means seeing those connections and holding our systems accountable to see them too. If you work in this space, if you're building solutions, funding research, or shaping policy, keep this context in mind. And if you're navigating this for yourself or someone you love, share what you learn. That's how we push this conversation forward. All the links, data, and deeper stories I talked about today are in this week's Fempower Health newsletter. Check it out, share it if it helps, and let's keep connecting the dots together. Thank you so much for listening today and for being a part of this community that actually wants healthcare to work. I'll be back soon. Take care. Thank you for joining me today on Fempower Health. If you'd like to continue the conversation, please follow me on social media. I am most active on Instagram, LinkedIn, as well as TikTok. You can also subscribe to the weekly newsletter if you want to stay off social media to get the latest and greatest updates. And you can find the link to that either on my website, fempower-health.com, which is a hub to all the different health topics I've covered over the past 5 years, or you can go to the show notes where there's links to all the helpful resources that are relevant to this discussion. And if you know of someone in your life who would benefit from this information, please do pass this along, because that is how we can ensure this important information reaches those who need it most. And for anything that is discussed medically, please understand that none of what we share on Fempower Health is medical advice. It is all for information purposes only, and only a conversation between you and your doctor can give you the care that you need. Thank you very much.